Diastasis recti is the normal separation of the ab muscles during pregnancy that can lead to abdominal coning. I fixed my 4-finger separation after the birth of my second baby and got it down to 1 using the BAM method, which employs breathing, alignment, and mindful movement. First, the breath, the diaphragm breath. Inhale through nose, exhale through mouth, and on the exhale, we hug the deep transverse abdominals in toward the spine or baby in. Inhale, fully expand your ribcage 360 degrees and your tummy. Exhale, use your deep abs to hug the baby in, or if you're postpartum, hug your tummy in toward your spine. You may not feel this in early postpartum days, but the more you do it, the stronger those deep abdominals become. So keep at it. At least 10 times a day, 10 breaths. That takes about 5 minutes. Next, be mindful of your alignment. So we want to make sure that when we're side sleeping, we have our shoulders, hips, and ankles supported by a pillow. When we're standing, don't thrust your hips forward, but keep everything stacked with a gentle bend in your knees. When you're sitting, try not to tuck your tailbone under, but aim for a neutral pelvis. And if you're pregnant, really let your belly hang forward. Mindful movement. Inhale, expand belly and ribs, and exhale, squeeze the physio ball and hug the baby in, or if you're postpartum, the tummy. This is going to help strengthen those abdominal walls and the connective tissue between your abs that has been weakened after pregnancy. This will help reduce the coning. Next, inhale, expand belly and ribs, and on your exhale, squeeze the ball and lift your hips while hugging your tummy or your baby in. Aim for 10 sets of the first exercise and about 6 to 8 of the next exercise on each side. We'll aim for both sides, so we take those reps down just a little bit so it's a little more manageable. Now I'm moving over to my other side and I bring my hand to my tummy to encourage that awareness of deep abdominal engagement. Inhale, expand tummy, and then exhale, hug tummy in as you lift those hips. Next, we're going to lay on our back and squeeze the ball with our elbow and knee, same side. Really give that ball a squeeze on the exhale as you also hug your tummy in. Do that about 5 to 8 times, depending on your skill level, and then switch sides. So opposite hand comes and squeezes the ball to the knee, and do that about 5 times. Each time you inhale, expand belly and ribs, and each time you exhale, squeeze the ball and the knee together while you hug your tummy in for that deep core engagement. Remember, we do both sides, so try the other side, and if it's too much to lift the head off the ground, you can keep the head rested so you don't engage those lower abs too much. If you're early postpartum, it might feel better to start with your head on the ground. Remember to do that cross-body exercise too for that cross-body engagement. Rest your head if you need to, and do that about 5 to 8 times on each side. Very good. Give yourself a nice stretch by hugging knees into tummy, and don't forget to like and subscribe.